Hello, hello, everybody. I'll just give it a few minutes for some people to come into the room. Um, okay, y'all. My co-host is running a little late because she was supposed to lead the show tonight. As you guys can see, I sound absolutely horrible. I have a severe sinus infection and upper respiratory infection, which I will take that any day because for a moment I thought I had COVID again, but it was not. I don't know. This pollen is just really horrible. Excuse me for the way I look tonight. I'm just like so out of it. Again, my co-host was supposed to be leading the show, but she's running a little bit behind. Um, Tonight we're gonna be discussing lupus because this is Lupus Awareness Month, and I do know several people with lupus. I have a very close family member who also has lupus. Um, so I know this is not a very comfortable disease. Um, and we just want to bring a little awareness to you tonight. We're going to be discussing different things. And I know this week, I'm not sure if Niece is bringing a wine. I did have one. And when I tell you I forgot it, because I was just trying to get out the door and get here to try to get things set up and get done. Um, yeah, I don't know if we'll be featuring a wine this week, but stay tuned. Thanks for coming into the den. This is your girl Bayou Diva, waiting on my host, Lady K, to join me along with Miss Jaquita Lewis, Miss Cut 'em Up Key. She is going to be one of our special guests tonight. And again, as I said, we'll be discussing lupus. Um, Let me just tell you, there are certain signs and symptoms of lupus. It's extreme fatigues, headaches, fever, hair loss, abdominal blood clotting or anemia, pain in your chest or lungs, sun or light sensitivity, fingers turning white or blue, which is called Raynaud syndrome, swelling in the feet, legs, and hands. These symptoms are actually associated with a lot of other diseases as well. So if you're feeling any of these symptoms, you would definitely need to see your physician right away. Um, some symptoms in most diseases are very similar and they have minimal differences. So oftentimes we go to the doctor and they want to run a lot of testing. Patients and people are angry because they're doing all these tests, but what doctors call it and what we call it is to rule out. So when your symptoms are similar to different diseases, they have to run specific tests so they can rule out certain things. Just like, for example, I have been so stuffy and so, oh God, it's just been, my throat has been like it's on fire for 2 weeks. So for me, being a nurse, I felt like it could be COVID, but I didn't have a fever. And COVID is definitely associated with a fever, but sometimes you might not get a fever. The runny nose, the congestion is what made me think it wasn't COVID, but because V had a coworker that her daughter had COVID and she was hacking and all of that. And V was sick the previous week. So that's what made me think it might have been COVID, but I was really hoping it wasn't. So once I got to the doctor's office and told her all of my symptoms, what she said was, okay, we're going to do a strep, we're going to do a flu and a COVID test because all of those three sicknesses have some similar symptoms. So in order for them to determine what's going on with you, they have to run several tests. So this is another thing with lupus. A lot of the lupus symptoms are are correlated with other diseases. So when you go and they tell you, oh, we need to run some tests, we need to let them do it because what they need to do is rule out to pinpoint exactly what's going on with you. So needless to say, they did the flu test, they did a COVID test, they did a strep test. All of them came back negative. And so she listened to my ear, she looked at my throat, and she came to the conclusion that it's just a severe sinus infection, which has drained down into my chest, which has given me an upper respiratory infection as well. So came home with lots of antibiotics and lots of stuff, steroids and all that stuff that I don't want to take because I don't like taking pills. So yeah, I wasn't really supposed to be talking tonight, but I guess I got to talk until she gets here. So um let's see. Mm, yeah. Um, you have to know one thing about lupus. It's not contagious. It cannot be passed from one person to another. It cannot be transmitted sexually, and you just no need to avoid being around somebody with lupus. Lupus is an autoimmune disease, so it attacks all of your organs. What we call your motor functions is the pieces of your body that helps your body work. So like your lungs, your heart, your kidneys, and things like that. It attacks those things. Um, so you just definitely have to go and get checked because those things, I mean, they could be correlated to anything. And one thing I like to tell my patients, and I like to tell people that if you feel something is wrong physically, 9 times out of 10 it is. So just go to the doctor, y'all. Just get checked out. I don't know why people hate the doctors. And another thing is, I hear all the time, well, he's giving me 3 medicines and none of them work. Well, you have to understand that doctors learn hundreds and hundreds of medications for one disease. And they're really just trying to see which one works for you. That's why you have to be specific. That's why they ask you, like when you're in pain, is it a dull pain, a sharp pain, a numb pain, a stabbing pain? They ask you all of that because those different types of pain can tell them exactly what's going on. So with the medication, you might have 5,000 medications for hypertension. There are basics that doctors use, like lisinopril is one of the top high blood pressure medications that are used by physicians. There's a couple of other ones, but they don't know what's going to work for you. Everybody's body is different. That's just like with a perfume. I can wear a perfume and it smell one way on me, and I can put it on Nisa, my co-host, and it'll smell different on her. So that's just like medication. It might work for me, but it might not work for you. So there are times that you might see a physician and you have to get several medications that's going to work for you. I hate when the patients say, oh, he don't know what he's doing. No, it's not that he doesn't know what he's doing. He doesn't know you. So he's trying to learn you. He or she is trying to learn you. They're trying to learn their patient. They're trying to see what is the need for their patient. So It's not that they don't know you, especially if you've been seeing them for so many years, you know. Um, it's just like it's kind of like, I don't want to say it's a game, but it's just we have to figure it out. We don't automatically know what's going on with a person. We have to run tests. We have to do these things, and a lot of patients don't like it. So anybody that's just tuning in to the den, we're discussing Lupus Awareness Month, and I was just going over some tidbits about lupus. Lupus is it's an autoimmune disease, and it attacks your motor function. Um, I was saying that a lot of the symptoms of lupus can be correlated to several different diseases. So doctors have to do several different tests, and most patients don't like that. They don't like testing. They feel like when doctors do that, they don't know what they're doing. I've been in the medical field for over 30 years, and I started out as a CNA, a MA, phlebotomist, now a nurse. So I've been around for a long time, and um, like I was saying, my co-host is running late. I was not supposed to be talking tonight. As you guys can see, I barely have a voice. And I use my situation as a example of what doctors go through. Like with lupus symptoms, there are other illnesses with the same symptoms. So they have to run tests to make sure that it's lupus. So, for instance, like for me yesterday, I thought I had COVID. I'm not a doctor, I'm a nurse. I thought I had COVID. But one thing that really made me think it wasn't COVID is because I didn't have a fever. But not everybody gets a fever. So I took my little butt on down there to the doctor's office. And when I told her my symptoms, she said, okay, well, this is what we're going to do. We're going to do a strep test because my throat is still on fire. We're going to do a strep test. We're going to do a flu test, and we're going to do a COVID test. So that's just with lupus. They have to do all these different tests to rule it out. Fortunately, all of those tests came back. My strep, my flu, and my COVID test came back negative. So what is happening? I accumulated allergies since I've been here in Atlanta, which I hate because in New Orleans I did not have any type of allergies. And so what's happening is I have a severe sinus infection, which has drained down into my chest, which gave me an upper respiratory infection. So um, going back to the lupus as using my situation as an example, they had to do 3 different testings to rule out. That's what we call rule out any of those things to see what's really going on. So with lupus and any other disease out there, they have to run testing because a lot of the time, a lot of illnesses have the same symptoms. So again, that's why the doctors ask you to be so specific. They want to know, like, if you're hurting, is it a sharp pain? Is it a dull pain? Is it a numbing pain? They want to know these things so that they can help you. And the more information that you give a doctor is the best way for them to help you. So a lot of people don't want to give information, don't want to talk to the doctor, and I would never understand that for my life. But um, you got to give the doctors the information. If you don't, they will never know what's going on with you. So it takes time, it takes testing, it takes patience, to kind of get taken care of and for the doctors to figure out what's wrong with you. A couple of lupus warriors that will be on tonight in just a bit. Yeah, hang up, man. I'm just see the thing. Not sure what happened. We lost you guys. Again. Whew, I'm trying, y'all. I'm trying. Please forgive me. This is Lupus Awareness Month, so we're discussing lupus tonight. We have a couple of lupus warriors who will join in on this conversation in very shortly. Um, Let me give you all some more information on lupus. So for lupus, there are several symptoms: skin and hair, which is photosensitivity. You get a butterfly rash or alopecia. Your heart, uh, your heart symptoms would be pleuritic chest pains, heart murmurs. Your kidneys will be inflammation or failure. Joints and muscles will be swollen or arthritis. Your mental is cognitive dysfunction, psychosis, seizures, and fever. And your lungs, pleuritic chest pain, inflammation, pneumonia, and pleuritis. Your blood immune complexes, blood clots, and anemia, and your mouth will get ulcers. So those are some symptoms. Those are also symptoms of a couple other diseases. Uh, so it is, especially if you have a family history of it, it would be wise to see your doctor, see your physician, and have them check you out. If you have any of those symptoms, like for me, just using me as an example, I come from a family of cancer, diabetes, and high blood pressure. Fortunately, and thyroid issues. Fortunately, I have none of those things going on with me. Um, I'm bordering the line of the thyroid issues that my mom had, but I constantly get tested. And again, like we talked about our very first show when we had a chiropractor on, know your history, know your family history, because knowing your family history is very important and vital to your future health. Um, I know back then a lot of parents didn't discuss things with their kids. They didn't talk about, what was going on with them. But I think that you should ask. You should ask. If you're old enough to know, you should ask about your family history because it goes as far out to your grandparents. And I could use, for example, like I didn't get high blood pressure from my mom or my dad, but my son did. So, and that's kind of like a generation thing. But I didn't get it, but it passed down to my son. He was diagnosed with high blood pressure at the age of 13 or 14. So it's always good to know your family history and know, what's going on. So when you go to the doctor, you filling out all that paperwork, which I hate. I hate we can simplify it, but it really is vital to your health information and how the doctors can help you. So don't be afraid to give the doctors information. Don't be afraid to let them know what you have, what you got, what's going on, because that's the only way they can help you. Being honest at your appointments and talking with your doctors. And so I actually snatched this one thing from my cousin's page today, the history. All the other information, of course, I know, but I snatched this particular one from her page today. And it says the history of lupus began in 1828 when the French dermatologist Bled described the disease. For the next 45 years, studies of the disease showed nothing more than a description that emphasized skin changes in the mid 1800s. Pierre Cazenave was the first person to have a comprehensive description of lupus. The disease was named because of a wolf bite shaped rash, the butterfly rash, that appears across the nose and cheeks of many lupus patients. Lupus is the Latin word for wolf. So that was interesting to know. I read that on her page today. I didn't know that particular part fact about lupus. So that was good to know and grab from her page. But it's just a matter of keeping up with your health, making sure you go to the doctor, y'all. Go to the doctor. There is nothing wrong with going to the doctor. Get yourselves checked out. Um, you gotta know your health, gotta know your, like HIV, like anything else, know your status. Know your status. You just don't have to know your status for HIV or for anything like that. You just you just need to know your status. So um so off of my Instagram people who just I'm just coming on, I'm sorry. I forgot about you guys tonight. I'm not feeling too well. Uh Waiting on my co-host to get here. Um Tonight we're discussing lupus and lupus awareness. If you guys have friends or family that have this disease, go out and do some of these lupus walks, volunteer, do something to um, help this disease. I think lupus is almost for me like, mm, ooh, I can't think of the other one that everybody that just don't know how they get it. Y'all just hang in there with me. Hey. Hey. My apologies, big call. So me and Kiki are. Mhm. It's right across. It's right across from the ice cream place, Brewster's, on the side of it. You see my van? My van is in the driveway. Did you pass up Brewster's ice cream place? Hold on, yeah. All right, y'all. Sorry about that. Um, so let me just get back to the lupus thing. So actually, lupus is like an inflammatory disease issue. So it's really an autoimmune disease. Okay, it can affect the joints, the skin, kidneys, blood cells, brain, heart, and lungs. Um, Unfortunately, it can't be cured. It requires a medical diagnosis, lab test, and can last for years or be lifelong. So it's a lot. Excuse me. So you can get treated by immunosuppressants, but no cure for it. I think it just kind of helps people have flare-ups and things of that nature. Um, but it's a horrible disease. I from the people I know with it, have said that painful. It causes a lot of pain. They're very tired a lot. Um, and anything that attacks your organs will make you tired, period. Especially your heart and lungs, that will make you exhausted. Um, and most of the time, lupus can really flare up and just have you down for some days, and then it'll just settle down again. So now for some reason, but like I was saying, lupus is kind of like heartburn. Probably not a good way to describe it, but sometimes when you eat certain things, you get heartburns, and then go away, and you won't have heartburns again. Won't come for a while, or they won't come back. But just like lupus, you have flare ups. It might last for a week, might last a few days, and then the flare ups go away. So it really just a matter of getting to a doctor, getting diagnosed. But like I said before, if you are and your body just don't feel right, then it's probably not. It's probably not right. It's probably to go to the doctor, see what's going on. It's probably something probably going on. I want to go and check, go to the doctor. On the other hand, B doesn't like doctors, so she doesn't go. She doesn't go yet. I try to get her to go, but one thing that you guys need to remember is prevention, prevention, prevention. Prevention is the key. Um, Unlike most people, they wait until they get utterly ill and then they want to go to the doctor. Like I did this week, I've been dealing with it for 2 weeks now. So, but this was like I knew it was mine. It's not new, but I just had to go and make sure because I didn't want to make the house sick again like I did when we all got COVID a year ago. Excuse me. So I found both and went to the doctor, and thank God it was just a severe sinus infection. So um, they loaded me up on antibiotics and all kinds of stuff that I'm seeing. Just go get checked, man. Do your yearly check. Do your yearly check. Um, now. My apologies, for real. Um, so make sure you go get your yearlies, make sure you get your checks, make sure you make your doctor's come on. Make sure you make your doctor's appointments and everything so that if situations arise like this, like lupus, you know, again, lupus has several symptoms that other diseases have as well. So you just need to make sure you go to the doctor, get checked out so they can rule things out and really figure out what's going on with you. So I see so we got Miss Kiki in the house. She's our special guest tonight. Oh yeah, that's Instagram. You got your people. Who's supposed to come in? Yeah. And upper respiratory infection. That's what I was telling them that I you know lupus has a lot of symptoms of a lot of diseases. You have to go to the doctor so they can rule out. It's like I finally went yesterday after 2 weeks, and I really thought I was sniffing and all that kind of crazy stuff. Trying to, whew, it's been a mess. Other than that, how was your day been? It's been okay. It's been okay. I'm just trying to get. I want my voice. I want my throat. Yeah, all that. I want my nose. That girl stuck that thing up my nose, honey. My nose was like a running faucet. She said, "What's going on?" I said, "You done unclogged it." Shoot, I ain't been getting nothing out of it. So, yeah. So it's important for us to know our health history, like our parents, especially grandparents. And I was using my situation for example, like my mother and my father, they were very sickly, and like, I didn't get all of things that they had. High blood pressure, glaucoma, diabetes, cancer. I didn't get all of those things. But I when I feel like when you feel like something is wrong, something is wrong. Yeah. So don't ignore it. Go to the doctor, go get checked out. Because you never know what it is. It could be something like for me, severe sinus infection to me is simple compared to having COVID, flu, or strep throat. But if you don't go and test it, then you'll never know. So, um, Sharon. So again, y'all, we got Miss Kiki in the house. Yeah. Granted, with the COVID, right? Yeah. I want to be at that brunch. Like, oh, geez, please don't let it be over. Lord. Jesus. No, it's like, pull your screen up. Pull the screen up. Up, yeah. You gotta put it on display. What's in the in